Welcome back to the Nursing School Blueprint, where we take complicated nursing concepts and break them down into simple, memorable lessons so you can understand what matters most and feel more confident in nursing school. Today, we are talking about a process your body performs every single day without you even thinking about it: hemostasis. Now, that word might sound intimidating, but I promise you, by the end of this lesson, you are going to understand exactly how your body stops bleeding. And more importantly, you'll understand what happens when this process goes wrong. This is one of those topics that shows up everywhere in nursing: pharmacology, medications like anticoagulants, lab values like PT-INR and platelets, blood disorders, surgery, trauma, and NCLEX questions. So grab your notes because we are going to break down hemostasis step by step. Let's start with the basics. Hemostasis literally means stopping blood loss. Imagine you cut your finger. Your body immediately activates a highly organized emergency response system. The goal is to stop bleeding while keeping blood flowing everywhere else. We do this through 4 steps: vascular spasm, platelet plug formation, coagulation, and fibrinolysis. Think of it like repairing a damaged road. First up, vascular spasm. This is the body's immediate response. When a vessel is injured, it quickly constricts. Think of your blood vessel like a garden hose. If it gets a hole in it, the first thing you would do is squeeze the hose to slow the leak. That is exactly what happens. The smooth muscle in the blood vessel contracts, causing less blood flow, less blood loss, and more time for repairs to begin. This response happens within seconds. Now remember, vascular spasm does not completely stop bleeding. It simply buys your body time. Next comes our platelets. These tiny cell fragments act like your body's first responders. When a vessel is damaged, platelets rush in. They stick to the site. Adhesion. They change shape and release signals. Activation. Then more arrive and stick together. Aggregation. This creates a temporary platelet plug. It's like putting your finger over a leak. It slows the bleeding, but it isn't strong enough for a long-term repair. That's why we need step 3. Now for the coagulation cascade. This is where clotting factors, produced mostly by your liver, work together in a chain reaction. The coagulation cascade is where clotting factors become involved. They work together like a chain reaction until we reach the final goal, creating fibrin. Fibrin is the strong protein mesh that stabilizes the clot. Think of the platelet plug like stacking bricks. The fibrin is the cement that holds everything together. Without fibrin, the clot would fall apart. The final result is a stable blood clot. Here's a key nursing point. Factors 2, 7, 9, and 10 need vitamin K to be great. This is why medications like warfarin, which interfere with vitamin K, increase bleeding risk. Now let's talk about something that loves to appear on exams: intrinsic and extrinsic pathways. Students often memorize these without understanding them, so let's simplify. Intrinsic pathway. Think inside the vessel. This pathway is activated by things happening within the blood vessel. It is measured by PTT, partial thromboplastin time. Remember, intrinsic equals PTT, extrinsic pathway. Think external injury. Something outside the blood vessel causes damage. It is measured by PT, prothrombin time. Remember, extrinsic equals PT. A common medication connection. Heparin affects the intrinsic pathway. Warfarin affects the extrinsic pathway. NCLEX loves these connections. The intrinsic pathway is activated by things happening inside the vessel. We measure this with PTT. Remember, heparin affects this pathway. The extrinsic pathway is triggered by external injury outside the vessel. We measure this with PT. Remember, warfarin affects this pathway. NCLEX loves these connections. Now imagine the injury has healed. Do we want that clot sitting there forever? No. Your body has to clean up. This process is called fibrinolysis. Fibrin is broken down and the clot is removed. Think of it like construction workers removing the barriers after a road repair is complete. The body knows when the repair is no longer needed. Now let's connect this to disease. If hemostasis is not working correctly, two major problems can happen. Problem number one, too little clotting. The person may bleed too much. Examples: hemophilia, low platelet count, or liver disease. The body cannot form a proper clot. Problem number two, too much clotting. The person forms clots when they should not. Examples: deep vein thrombosis, pulmonary embolism, or stroke. The clot becomes dangerous because it blocks blood flow. As nurses, we monitor patients at risk for bleeding. Watch for bruising, bleeding gums, blood in the urine, or black stools. Accuracy in recognizing these signs is critical. When caring for patients at risk for clotting, we watch for swelling, pain, warmth, shortness of breath, and chest pain. We also monitor important labs: platelets, PT, INR, and PTT. Understanding hemostasis helps you understand the why behind these labs and medications. Before you go, let's review. Hemostasis has 4 steps. 1. Vascular spasm. Vessel constricts, slows blood loss. 2. Platelet plug formation. Platelets stick together, temporary repair. 3. Coagulation. Clotting factors activate. Fibrin strengthens the clot. 4. Fibrinolysis. Clot is broken down when healing is complete. Remember, platelets make the plug. Fibrin makes it strong. Vitamin K helps clotting factors work. PT equals extrinsic. PTT equals intrinsic. Nursing is about understanding the why behind the body's actions. If this helped you, subscribe for more lessons to help you survive nursing school. I'm Nurse Nova, and I'll see you in the next one.